I will now call the public portion of the meeting of the Standing Committee on Social Development to order. My name is Caitlin Cleveland. I am the MLA for Cam Lake and chair of this committee. Today, committee will hear from the Department of Health and Social Services on the NWT Recovery Experiences survey results. Please know that this can be a difficult topic for some. Today's meeting is being live streamed on the Assembly's social media channels. I would like to remind all members and our witnesses to please direct all comments, questions, and remarks to myself as chair and to wait to be recognized before speaking to help the meeting run smoothly. Please keep the presentation under 20 minutes to allow time for our public to enjoy this presentation and follow along with us today, and to also be able to allow members to ask questions as well. I will now ask members to introduce themselves for the record, starting to my left with MLA Knockleby.
Thank you, Madam Chair. Good morning, good afternoon. No, we're morning. Katrina Knockleby, MLA, Great Slave.
Lisa Semler, MLA, Inuvik Twin Lakes.
Rocky Simpson, Hay River South.
Ron Bonadrus, MLA, Decho.
Jane Wayellen Armstrong, MLA for Morphe.
Kevin O'Reilly, Frame Lake.
Thank you very much, members. I will now ask our officials from the Department of Health and Social Services to introduce themselves as well and to proceed with any opening remarks and their presentation. Ms. Tchaikovsky, the floor is yours.
Thank you. Good morning. I'm very pleased to be here today to speak with you about the results of the NWT Addictions Recovery Experiences Survey. I have with me here today Ms. Brittany Denning. She is the Senior Advisor on Problematic Substance Use and was a key partner in the design and analysis of the survey. So I'm going to be doing the presentation today, and I'm just going to jump right in, and then it would be Bri and I both who probably would field questions. Okay, so the results of this survey are obviously extremely valuable in that they provide our health and social services system with a broad overview of resident needs, preferences, and experiences, both the good and the bad, with regards to accessing addictions recovery services and supports. We do intend to use the results of this survey to help inform future program planning and priority setting in order to ensure that our services are responsive and can meaningfully address the needs of residents who are working towards addictions recovery. Next slide, please. So this slide is an overview of the respondents. So in total, we had 439 surveys completed or used in the analysis, and the demographics from the surveys show the majority of respondents identified as Indigenous, over 2/3 of respondents identified as women, and the vast majority of respondents were between the ages of 20 and 64, with the 35 to 49 age range being the most highly represented. Next slide. Okay, so this slide illustrates the overall services that were accessed by residents for addictions recovery. So we can see from this slide that one-on-one counseling was a key source of support for people, and that was the most commonly used source of support. Other common supports were healthcare system, peer support, facility-based treatment, and group counseling. Next slide, please. So this slide looks at the number of different services that individuals access for their addictions recovery. And you can see from the data that it's clear that most individuals did choose to access more than one service, with an average of about 2.5 services being used. However, there are some individuals who did report accessing as many as 9 different services. Younger respondents, women, and Indigenous people reported using more services than older, male or gender diverse or non-Indigenous respondents. And I think overall this slide really illustrates the importance of options, that there's no one size fits all. And it really does validate the approach that the Health and Social Services has been taking, the approach that we've been taking in recent years to ensure a range of options for people to choose from based on their individual preferences. Next slide, please. Okay, so this slide speaks to the service user satisfaction with the services that they accessed across a few key domains that are listed on the left-hand side. The squares in blue show particularly high levels of satisfaction, so areas where it was above 80%, and the squares in red show satisfaction where we had levels that were less than 60%. As you can see, overall, there was a fairly high level of satisfaction across all services, especially when it comes to safety and confidentiality. And that's great news, and it's very reassuring because we do know that feeling safe and feeling confident that your information will be kept private is critical to people feeling safe and like they can reach out for help. Positive feedback was received about land-based services. Users of those services reported high level of satisfaction in all areas, and that does help to further point to the critical importance of land-based services as part of the larger continuum, which I think we all knew, but it's great to hear that people are satisfied with the services that are out there. The data does show less satisfaction for things like respect for individual needs and overall changes in individuals' lives, as well as with things like detox and withdrawal services in general. So overall, these findings are important because they point us to the areas where we need to make improvements, but they also highlight the areas where we're doing well and where there may be opportunity to translate positive practice and lessons learned to other program areas. Next slide, please. So this slide speaks to the services that people were not able to access. So services that people wanted to access for their addictions recovery, but for one reason or not, they were unable to do that. The number one service that people said they wanted to access but could not was land-based healing, and it was followed closely by community-based treatment, facility-based treatment, and detox or withdrawal. So this is useful information for us, obviously, to have to be used in priority setting and program development. And it does also indicate the importance of having services available at the community level, as well as the importance of culturally based program options. Next slide, please. So in follow-up to the previous slide, this one looks at the reasons why people could not access the services that they wanted to. The number one reason was that the service was not available in their community. So again, pointing to the importance of enhancing community-based programs and services. And results also show that even if a service was available, people were either not aware of the fact that it was available or they didn't know how to access it. So these results highlight not just the importance of making sure that programs and services are available in communities, but also of ensuring that we're doing a better job communicating to community members about what services are available and how to access it. Next slide, please. So facility-based addictions treatment is a key component of the larger recovery continuum. And while it's not a service that all people want or need to access, for many people, it is an important part of their recovery plan. And so because of this, it is a service that's top of mind for residents when it comes to addictions recovery programming. And because of the importance of this service to the larger continuum, the survey did contain an entire section that was devoted specifically to facility-based treatment and people's experiences with that service. The results show that of the respondents who reported having attended facility-based treatment, the majority, so 85%, reported having completed their program. For those who did not complete their program, the main reasons they cite were that the program was not meeting their needs, the program was too far from home, they couldn't be away from family responsibilities, and they were not ready for treatment. Next slide, please. So in general, there were high levels of satisfaction reported across the board for treatment programs. For example, satisfaction was particularly high with the respect shown for people's individual needs, preferences, and values, the safety of the environment, the confidentiality of their personal information, and the overall changes in their lives. Next slide, please. There's also been a great deal of attention and commentary on the perceived need for an NWT treatment facility. So in an effort to better understand the preferences of residents with lived and living expertise, the survey did ask respondents who had attended treatment whether they would have preferred to attend treatment in the NWT rather than have to travel south. The results show that approximately 2/3 of respondents indicated a preference for a treatment option within the territory. So on the surface, this seems pretty straightforward, but when we look at the reasons that people would have preferred to attend treatment in the NWT, the issue does become a little bit more nuanced. So the main reasons for wanting to attend treatment in the NWT are related to not wanting to travel, feeling anxious to go somewhere that's unfamiliar, wanting a culturally relevant program, and wanting to remain closer to home and to family. So this feedback is really important to take into consideration for us because it does indicate that while treatment in the NWT is clearly being requested, We're also hearing that one single treatment facility may not adequately meet the needs of residents. If we had one single facility here, people would still need to travel away from their friends and family to attend treatment. Similarly, it would be difficult for a single program to adequately reflect the many and varied cultures of the NWT. And in addition, we do have the wishes of the 33% of respondents who did clearly articulate reasons for preferring a treatment option in the South. So again, we see the importance of options, the lack of a one-size-fits-all approach. And so this is an area that does require some further investigation as to how best we meet these varied needs, these treatment needs for residents. Next slide, please. So moving beyond the issue of specifically facility-based addictions treatment and the best way to deliver that service, the survey also asked residents about their experiences that they had after taking a step attending treatment. So relapse, as we all know, is a normal part of addictions recovery, and not surprisingly, the majority of respondents to the survey did report having experienced a recurrence of substance use or relapse. The top three things that residents cited as leading to relapse were a lack of supportive social networks, a lack of supports and services in their home community, and a lack of proper planning for their recovery. They also cited things like life crises, stigma, pressure from others, and family challenges as common factors that made it difficult for them to stay in recovery. These results again indicate the critical importance of community-based supports and networks to the long-term outcomes of individuals. Next slide, please. So in addition to asking about the factors that make recovery more difficult, we did also ask people about the things that they found helpful in maintaining their recovery. So not surprisingly, the results once again point to the importance of options. The data shows a wide range of services and supports that people say help them to stay in recovery. And the most common things that they mentioned were relationships with family, relationships with friends and other people in recovery, regular exercise, and meditation or mindfulness. So it is of note that the main sources of support that people lean on are informal and community-based. We know that recovery is not a thing. It's not about a particular aftercare program or a specific service. It's absolutely a process, and it is absolutely a lifestyle change. And the availability of these healthy relationships and communities is critical to that success. Next slide, please. So in summary, the results of the survey are obviously, as I mentioned, invaluable to the health and social services system as we work to enhance and improve options for addictions recovery. There are a few key themes from the results that we'll be paying close attention to as we work to use the results of the survey to improve services. And these are the importance of increasing access and choice by making services available in more communities, the importance of reducing stigma so people feel comfortable to ask for help and access services, the critical importance of addressing racism to ensure culturally safe services and supports, the ongoing importance of protecting confidentiality so people feel safe to access services, and lastly, the need to increase local access to addictions treatment options. Next slide, please. As I mentioned previously, the survey results provide valuable information for strategic planning, program development, and resource allocation, and the results clearly show what people need to have the most success in their addictions recovery. That being said, the results also provide information on where services are already hitting the mark and where we're already taking steps in the right direction. We know from the results that counseling, primary care, land-based healing, and peer support are services that people want to access for their addictions recovery, and that they want to access these things as close to home as possible. These preferences are already being enhanced by work currently underway in the health and social services system. So some examples include the elimination of wait times for counseling and the establishment of same-day access through the implementation of the Step Care 2.0 approach, and the establishment of distance-based addictions recovery supports like the recently launched Wagon Addictions Aftercare App. Enhancements to land-based healing that includes a specific focus on mobile treatment and family-based aftercare, the provision of funding to communities in order to support locally based peer support options, as well as local or traditional counselors who can provide direct support and the delivery of recovery programming at the community level, work to establish a territorial model for detox so that people in all communities will have access to that service, taking steps to create sober transitional housing options for people returning from treatment. People may have noticed that an expression of interest seeking communities interested in delivering that type of service was just issued on December 1st. And the reorganization and new investments into the Community Culture and Innovation Division within the department. That division will serve as the foundation and the driving force behind the systemic changes that need to happen to ensure cultural safety for residents accessing our services, including those that are focused on addictions prevention and recovery. So this is not to say that there's not more work to be done or that we can't do better. Certainly we can, and we're working towards it. But at the same time, it is very reassuring to know that the investments that we're making and the programs that we're working to establish align with what residents are saying they want and what they say are most helpful for them to work towards addiction recovery. The results also point to the critical importance of community, family, and culturally based supports as part of the larger continuum. We know that the work that needs to take place to support individuals impacted by addictions can't be done by the health and social services system alone, and the department is committed to working with Indigenous leaders and communities to ensure that these community-based supports are connected and integrated with the GNWT programs and services. Next slide, please. Moving forward, the department does have some key plans for the immediate utilization of the survey results. So the first is to share the results with key partners and stakeholders. So we've already made the results public on our Health and Social Services website, really so that those individuals who took the time to share their experiences with us can see the results. We want residents to know that their voices were heard and to see the overall feedback that's been received. In addition to this, we will be sharing the results with GNWT partners via the Territorial Committee on Problematic Substance Use that is set for January 13th, 2022. Because as well as with key NGOs and service delivery partners who assisted us in promoting the survey and who are critical partners in the delivery of addictions recovery supports to residents. In addition to the knowledge sharing, we'll be taking steps to ensure alignment with the development of the territorial alcohol strategy. The survey results contain key information on how to support recovery through informal community-based supports, and that's relevant for the work as a strategy as it ultimately relates to the development of community-level alcohol strategies. Third, we intend to conduct further engagement to assist in identifying the best way forward to meet the needs around community-based supports and services, including facility-based addictions treatment needs of residents. So the results showed us that it's not a black and white situation of either having a treatment facility or not having one. The focus needs to be on how we ensure addictions treatment as close to home as possible and in culturally respectful ways that allow for the involvement of family. So to do this, we need to engage with community and Indigenous partners to understand how we can work together to address this need. The intention is also to engage with the Mental Wellness and Addictions Recovery Advisory Group, the Indigenous Advisory Body, and the Leadership Council in order to identify options and opportunities that meet this important need to see how we can leverage existing resources to ensure wraparound supports at the community level. And lastly, we intend to repeat the administration of this survey every 2 years in order to measure progress and ongoing satisfaction levels. So in conclusion, the department understands the critical importance of hearing from the people who use our services about their experiences, both good and bad. We're committed to continuing this type of engagement and to using the results to inform meaningful action and change so that residents are supported to achieve their wellness and recovery goals. And that concludes my presentation. Thank you.
Thank you very much, Mr. Czerkowski. We really appreciate both your valuable time and also sharing this information both with committee and also with the public that is following along. This is a very important topic for committee, and I know that there will be some questions from committee today. And so with that, I'd like to turn it over to any committee members that would like to start with questions. MLA Knockleby.
Thank you, Madam Chair. Thank you for the presentation. There was a lot in there that I was really glad to hear around engagement and consultation with Indigenous organizations and government, hybrid models, lots of different options. The one size fits all, or doesn't fit all, sorry, I think is a very valid point. So I'm glad to hear that, but I do get concerned about this just being more lip service around this kind of thing, and without there actually being movement to create those options for people, and waiting and more consultation, that people over that time are just going to continue to fall through the cracks. So I urge, I guess, the department to be more, maybe not waiting until they have the 100% model that's perfect for everything, and instead getting some of these in the north NWT made solutions going, and like I think funding the Indigenous organizations to do so is probably a better move at this point, given the history of and trauma that has been endured by people at the hands of the government. So I guess just more of a comment, and then I guess my question would just be is that in your presentation, all of the stats were percentages, and I think a key important factor, and I maybe missed this, is the size of the survey set and how many people were actually engaged in the survey. It's great to say this is indicative, but I apologize if that was stated and I just missed it. But yeah, getting those numbers, I don't need them today. Thank you.
Thank you very much, MLA Knockleby. Ms. Trakowski?
Thank you for the comments. I absolutely agree with you that we need to move on this, and I think there's examples of how we're already doing that. But there are areas as well that we do need to work with our partners to understand better to make sure that the steps that we take are informed by the needs of communities and what they want. In terms of the percentages, that is what we used for the purposes of the presentation, but the specific end values are in the larger report that was released and is available online, and I think has been read to committee. I'll just ask Bree if I'm misstating, but I believe that all those values are in the report.
Yes, we had 439 total respondents, but for each question, different people answered. So if people answered questions specifically to things that they had accessed or wanted to access, so the end changes with every question. I'll just say that we were not looking for a statistically significant sample at this time. If we were, it would have been a broader survey and we would need to do more outreach in it. And so that's something that we can look at if we want to get more statistically significant information. It was really a preliminary look at where people in recovery wanted to see change and where they had good or bad experiences.
Thank you very much, Ms. Denning. MLA Knockleby?
Thank you, Madam Chair, and thank you. I appreciate the sort of clarification around that. And yes, I'm sure I probably have that information. We just get a lot of information all the time, so it's hard to always remember. I guess my next question is, one of the biggest things that I hear is missing, or the gap, is the aftercare, like you mentioned in the presentation. I'm just wondering if the department is exploring like sober living homes and that kind of situation where people do want to return to their community, but necessarily not to their specific home, and they need that support of being around people with a counselor or someone in the facility or in the home with them to provide that ongoing support. And I just want to know if the department is looking at that type of option. Thank you.
Thank you, Emily Knockleby. Mr. Rutkowski?
Thank you for the question. Yep, we absolutely are. And I did just briefly touch on it in the presentation when I referred to the expression of interest that's been recently released for the transitional housing units. So that is absolutely intended to provide that exact support for individuals returning from treatment. And we are looking to work directly with communities on the delivery of that services, hence the expression of interest that was just released on December 1st.
Thank you very much. Emily Bonnet-Rouge.
Merci, Madam Chair, and merci to Sarah and Bree for their presentation. I'm not sure if you've been following us since the start of the assembly, but we've been touching upon having our own NWT Own Addictions and Recovery Centre here in the Northwest Territories, and it can mirror the services that are provided in the South. It's just that it's NWT owned and culturally based for many of our people that attend are First Nations people. And it's encouraging to see, your page 10 about those that answered that they wanted the facility in WT, and of course my previous speaker, my colleague there, mentioned we don't know the numbers, but the percentage is up there at 67% that wanted to see our own facility in the NWT. It could be based on maybe 4 or 5 people. And I think we had asked previously to the ministers, Health and Social Services, and to the departments, if it was possible to go out with an NWT-wide survey. to see, engage if there was a need for NWT his own addictions and recovery center, and that never ever come to fruition. We're in second year now, and still nothing in that regard. I'm just wondering from this survey here, this one here specifically, where people are asking for an NWT own facility, if that message is relayed to the Health and Social Services Minister and Senior Management. Masi.
Thank you very much, MLA Bonnet Rouge. Mr. Trukowski?
Thank you. I think what I can say is that this message, the Minister of Health and Social Services has been briefed, as have leadership within the department, on the results of the survey. So, the numbers of individuals indicating that they would like to have treatment services available here in the territory is known and is understood. So we absolutely do hear that. I think we see that preference, but when we want to take a thoughtful approach to how we work towards establishing things here in the territory, because what the results indicated was that maybe one facility might not work. And so it makes us wonder, are there different approaches that might better meet the needs of the varied individuals across the territory? The results show that there is no one-size-fits-all approach. And so I think we have a little bit more work to do there to understand how we should best work towards making wellness and recovery options in the territory a reality. And I don't think we're quite there yet, but that's some of the work that we're going to be doing now to understand that a little bit better.
Thank you very much. Emily Bonnet Rouge?
Merci, Madam Chair. I'm not sure we're there yet. I kind of don't know where you're going with your answers, but what I wanted to touch upon another aspect there that I can't find that page there, but what could be included in that is the detoxification program. Because what seems to detoxification and withdrawal supports, that's what's here, could be included into those programs, and I think we really need to have that, because what I notice is happening with the health department is that we're feeding those addictions. We're giving people alcohol and cigarettes and what have you, to kind of calm them down or to keep them intoxicated. Our culture up here as First Nations people is to help people so they can kick their habits, their addictions. And we should be really promoting and looking at that more. So a detoxification withdrawal support center would fit nicely into this addictions and recovery center that NWT own and made in NWT. I'm wondering, what are your thoughts on that, Masi?
Thank you, Emily Bonnet Rouge. Mr. Trukowski?
Thank you. Yep, I think that we would agree that we need to do a better job when it comes to withdrawal and to detox services. That actually is a mandate item for our department, and there's active work happening right now in terms of developing a model for detox. That would be a territorial model to make sure that it's available for residents across the territory, because we recognize that there are gaps there right now. In terms of whether that would be something that would be, included in a wellness and recovery center down the road, I think that's a really good point, and one that it's a great suggestion that we can keep in mind.
Thank you very much. Next on my list, I have MLA Simpson.
Thank you, Madam Chair. And I appreciate the presentation. Just looking at the demographics, I guess, of the respondents, I think it was 57-43, which I guess kind of comes out. To me, I guess I was surprised to see that number. I thought on the Indigenous side it would be a lot higher. And then I'll also look at, on page 7, at the service was not available in my community at 43%. So with the respondents, I know there was a small sample, but was this more in Yellowknife, or by looking at the 43%, it seems like on the Indigenous side, it may be a lot of the respondents came from smaller communities. Like, I'm just trying to grapple with you know, where that sample size came from. Was it Yellowknife primarily, or was there uptake from outside Yellowknife? Thank you.
Thank you, Emily Simpson. Mr. Rakowski?
Thank you. I'm actually just going to see if Ms. Denning would be able to field that question better than me.
Thank you very much. Ms. Denning, the floor is yours.
So we actually didn't collect data on the location of individuals, mainly because we knew that in the sample this size, we wouldn't actually be able to report on it. That is something that we can look at going forward for the next iterations, as well as we're looking towards doing another iteration of the addiction survey, which can provide that information on a more granular level. So in short, we don't have that information for this survey just because we knew that our sample was likely going to be too low for us to be able to provide that information.
Thank you, Ms. Denning. Emily Simpson?
Thank you, Madam Chair. I guess the other thing is I look at this and I'm always looking for ways to take this information and action some of it right away. But I see that at the last slide, it's more, you know, we continue looking at, you know, what's needed. But when I look at, like, the service was not available in my community, well, that's something at 43%, there's something we can action there right away. When I look at that, there's no reason why we can't try to do something with it. And the other ones, I don't know how to access this service. I didn't know how to access this service. Well, 23% of the people, there must be something we can do there. So does the department look at that and say, you know, what can we do to you know, action those two items? Thank you.
Thank you, Emily Simpson. Mr. Rakowski?
Thank you. Absolutely. When it comes to people not knowing about what's available in their community or how to access it, we absolutely actually have already started to take some steps on that one. We're working with the Health and Social Services Authority to design sort of a comprehensive communications approach. We know that we need to do a better job of communicating to residents what's available and how they can access that. So that's something that we're actively working on right now and that we think we can move quite quickly. There's no reason why we can't quickly start to do a better job of promoting and communicating our services in a variety of ways. When it comes to putting services in community, we are already taking steps towards that as well. We recently rolled out a fund support and for addictions recovery and aftercare. So that is meant to increase the options that are available at the community level, as well as the ongoing work towards the transitional housing supports and the withdrawal and detox. So there is work already happening that I think is going to make a meaningful difference sooner than later for folks.
Thank you very much. MLA Whalen Armstrong?
Thank you. Thank you for the presentation. I know, addiction is a major issue. We know that. So we know that NWT is in a crisis situation with addictions, and we need to address more and spend more money in that area. And I know that GNWT is going to say, well, we are spending 3 to 5%, of their capital budget to addiction, but we know that's not enough. And we need more. And I see that your survey shows that the respondent is high for man and woman. So being a parent, being a parent, and so living in a small community, everybody is affected by the addictions, whether it is drugs or alcohol. So yes, we're reaching out for, we're readily responding, saying we do need help. So it does recognize that, okay, we need to do something more. But I see the survey respondent for youth between 16 and 19 is very low. So there is still denial there, but so we need to. So what can we do to help We need more program and services, and you guys have identified in that, in the report that we all know we lack a lot of services, to meet the needs of our young people. So if we can do more in that area to help our young people, will be good. Another one too is that for the aftercare, we know that, okay, why, and I've been doing it here for the last 10 days, member statement on housing. Okay, housing is a major issue. So a lot of these people, the people with addictions, they don't have no housing. So when people go for treatment, they come back, they get off the plane. Is there anybody there to meet them, to help them? And when they go home, they go back to the same situation. No housing still. So you still feel helpless and hopeless in the whole situations. So, and then sometimes you go back to the same family, like where the problem, not where the problem was. It's just that, like you try to get yourself out of there to get yourself, to go for treatment, to work on yourself, for healing. But you go back to the same situation. So the family, it's not just a person that went for treatment that needs help. It's also the family. So what are we doing to help the family that were left behind? So if we don't have collaboration in there, so yes, people will, have a relapse. So, yeah, thank you.
Thank you very much, MLA Raylan Armstrong. Ms. Chirikowski?
Thank you. Thank you for the comments. And I think there were a lot of key points in what you just shared. So what I kind of heard was 3 key things around the need to do better supports for youth, the need for better housing supports when people return from treatment, and then also the need to support the families that are involved as well. I would agree with everything that's been stated, and I think that we do have supports available for youth. People are familiar with the Child and Youth Care Counselor Initiative, which is in the final phase of rollout, and we are in a stage where we're going to begin evaluation of that initiative, recognizing that, it's one thing to put it in place, but it's another to make sure that it's meeting the needs of youth. So that is a phase that we're going to be moving into next fiscal. We also have things like the My Voice, My Choice campaign, which has been dormant for a period of time. It's a mental wellness campaign aimed at youth, and the topics that are being covered are informed by youth engagement that we did with youth from across the territory. So that campaign is actually going to be relaunching in the new year, and it will have a focus on drugs and alcohol and on substance use. And then also one of the other things that we do for youth is the Talking About Mental Illness program, which is available in schools. I'm not sure if people are familiar with it, and I know that it's not specific to addictions, but really what it's focused on is trying to raise the topic of mental health, how to recognize when you might be struggling, how to try to access supports, and to really reduce the stigma around it, because we really do know that mental health and addictions are intertwined, and that a lot of times addictions is a coping mechanism for those underlying mental health issues. So that is one other thing that we work with the education system on, putting in place in schools to try to support youth with their mental health. When it comes to aftercare, I absolutely agree. I think when it comes to housing, that is a gap, and that is something that we're hoping to address with the expression of interest that we have recently launched. We're hoping to hear from community groups that are interested in operating supports for individuals returning from treatment to give them an opportunity to sort of solidify the skills that they've developed in treatment, to build relationships with other people and support networks with folks that are also working towards addictions recovery. So, recognize that that's not in place right now, but we do see that as a gap, and we're taking steps to try to fill that gap. And then in terms of the family situation, absolutely, when somebody's gone to treatment, there probably needs to be a better job of making sure that we're reaching out to families and connecting with them to support them while their family member is away. But the only other thing I would just mention on that is the On the Land Healing Fund and the enhancement that was made to that fund back in 2019-20, which now includes funding that is specific to either mobile at treatment or to family-based aftercare. So there is some funding there that Indigenous governments can use to try to support some families. I hear the point that it's probably not enough and we probably need to do more, but, you know, at least it's a start and it's a step in the right direction. Thank you.
Thank you very much. MLA Whalen Armstrong, do you have?
Okay, yes, thank you. I do believe in the on-the-land treatment program. I know we need to do more in that area. So it's frustrating when we're talking about addiction because it is a crisis. It is a crisis, especially in the small communities, and a lot of people are suffering. You know, so every families are affected in the communities. You know, by these addictions, and we've been told what to do all our life and been studied. You know, and it's really frustrating. So we've been told what to do by the government for so long. So now I think what the government should do is that work with the people, work with the government, let them do the program that will meet their needs, not from outside coming in and telling us what to do. That's enough, you know. That's where the resistance is going to come, because we've been, like you said it all in here, and what people are saying in the report. So I think it's about time now that the government recognize and say, okay, we will leave this up to you, because before colonization, we were okay, until they came and said, okay, well, how you're living is not good. And alcohol was introduced to us by the fur traders. We all know that. So I think it's about time the government, you know, does the right thing and let the communities do their own program based on their needs. Let's see. Thank you.
Thank you, MLA Whalen Armstrong. Ms. Tchaikovsky?
Thank you. And thanks again for comments. And I hear you, and I 100% agree. And I think that's some of the direction that we're trying to move in with the community-based funds that really put the control in the hands of communities to design and deliver those programs. So thank you.
Thank you very much. Next, I have MLA Semler.
Thank you, Madam Chair. Thank you for the presentation. I think my colleagues have took most of the questions and but the one thing that stood out to me, well, there was two things that really popped out to me, and it was the Aftercare App. And in my previous work, I worked with residents who were coming back from addictions treatment. I don't know where they would have accessed an app or a computer unless they came into my office or to one of my colleagues' office to do any of that. They're homeless, they don't have a cell phone, you know, and this is, I mean, I've gotten ministers send me links, get an elder to fill out this form, you know, and in some, you know, there are some elders that are very tech savvy, but there's even a lot of us that are not that old that are not that tech savvy. And so I think when we start to put everything online and we think that it's going to reach farther, it actually that's a barrier. So and that could be related to some of the stuff that Member Simpson said, is that they didn't know it was there or is available because it's online. It's not, you know, like we used to do it on the radio. We used to, you know, go in to see our doctor, and, you know, people who are accessing the shelter, there should be forms, and I'll relay it back to outreach addiction workers. We have counselors, we have you know, we have all these other people that sit in their offices where we could go to, but we don't have anybody leaving their office. And within government, you know, we have a lot of NGOs, which is great, but the NGOs are doing that work, but I think there needs to be more support from the government side, because there's that partnership there that they need to be having these outreach workers prioritizing those clients coming back from addictions treatment and a real solid plan. Like, where am I going to sleep and where am I going to eat when I get to Inuvik? You know, even something as basic as that. But I'll leave that there. I want to go to the experience. What I really wanted to say is looking at this question here where 67% say NWT, and then when the presenters say, well, and the reasons they given, well, they don't like to travel, they feel anxious to go somewhere. That right there, we've been talking about this not just with addictions, but with medical travel. People are sick and they're dying from things that could be treated because they're afraid to travel. We're losing people to addictions because they're afraid to travel. But yeah, you know, if they had support to a travel to get there with a comfortable support person, it's the medical travel policy right there. Like, if you had your family member who was saying, well, you come with me, at least walk me to the door, make sure I'm okay when you leave me there. But our medical policy, travel policy doesn't call for that. You know, so that's a barrier. But I also said, it says that there's 67% that say they want an NWT facility. Majority of our small communities would probably travel to within the regions or to Yellowknife. Edmonton is a scary place for if you've never left the Northwest Territories. Yellowknife's scary, but they could usually find somebody that they know or are familiar with, and at least the culture is understood. So I disagree with that comment. So I think that it's not just the travel out of the small communities. I think, you know, if we had a regional facility, you know, smaller facilities working with Indigenous governments to provide culture-based treatment, addictions treatment, I think we could do it with less money that we are spending, sending people out. Those are my comments. I don't know if there's much questions in there, but those are my comments.
Thank you very much, MLA Semler. Ms. Truskowski?
Thank you. And I do appreciate the comments / questions. I think, you know, maybe what I can do instead of answering a question is just provide like a little bit of information. Just in regards to the reference to the app piece and the Aftercare app, absolutely, I hear you. And, you know, the apps are not meant to replace anything. They don't replace face-to-face services or other services that people may choose or prefer to access. Really, the purpose with the app was to just provide another option, right? So we've seen from the results, and I think we all know from previous engagement that, you know, there is no one size fits all. Everybody wants different things. People want to try different things. And so it's just something else that we can offer people. It's certainly not meant to replace, nor do we think that it's going to be the answer for everybody. But for people who like it, it's probably a good added support for them. And the only other thing I would just, well, couple things. One is just for folks who do have to travel south to attend addictions treatment, I do just want people to know that, you know, we take a slightly different approach to the need for escorts than might be taken in other areas of the system. And, you know, we recognize the risk that people can face and the fear that people may have and, you know, the chance that people might use on the trip. And so we absolutely do, if there are folks who need escorts, that is something that we do provide and that we can actually make the determination on sort of here internally at the program level. So if that's something that somebody needs, they should ask for that. And we actually do ask whether somebody needs an escort on the application form. So we ask that for everybody. So I think that's just, I just want people to know that is an option and shouldn't be seen as a barrier. And then in terms of the comment around, you know, treatment in the NWT, absolutely. And I think the suggestion of, you know, sort of regional centers or working in partnership with Indigenous governments, I think those are the things that we absolutely want to explore further. It's not that we're saying that we're not going to look at options in the NWT. I think it's that we need to look at what are going to be the best options to meet the needs of residents. And that is one example of a really great suggestion. So thank you.
Thank you very much. MLA O'Reilly. Oh, you. Oh, sorry. Yes, you do. Oh, I'm sorry. MLA Semler. No, thank you for calling me out on that. Thank you. MLA.
Thank you, Madam Chair. Yeah, and I think I just wanted to kind of also speak to the aftercare, when we, the only way I can describe it is that fear of, that that your clients and the person that is going out to treatment, whether it's an NWT treatment, whether it is a southern facility, although we don't have an NWT treatment, we do in Yellowknife, but that same fear, and that's why I don't think we've been prioritizing the aftercare, but it's that same fear when they're coming out of treatment, because they went in one person and now they're coming out a different person, and my colleagues have said it, and they're going back to that same, so, having that person there to, and that's what I was saying, if it's the aftercare worker or the outreach worker, somebody is there meeting them at the airport, taking them, and they have a warm bed, and they have a plan, and they have, if it's this week's plan, and these are the programs that, that we talked about that you can take, and then working within the communities on maybe part-time jobs for them to keep, these are the types of aftercare that we need to hold their hand like we would in treatment, after treatment, until we can, it's like a parent. We have to help our children, and we can hold their hand as long as we can until we feel like, okay, we can let you go, and some sooner than later, and some later than sooner. But that's where I think we're missing the buck, and I think that's why we continue to have relapse after relapse, because we do, and your report said there's no services, lack of services, lack of that support, and sometimes it's not in the small communities, but if we at least have some kind of structure for them in the regional centers, they're going home to the regional center. For the short-term plan, long-term plan, we get you home to your community if that's what you choose. So I think that needs to be really focused more on is the aftercare. Thank you.
Thank you very much, MLA Semler. Ms. Czerkowski?
Understood. I don't really know what else I can say. I hear you, and it's all valid points and stuff that we will take into consideration to work at improving. So thank you.
Thank you very much, Ms. Czerkowski. Emily O'Reilly.
Thanks, Madam Chair, and thanks to the presenters and the work on the survey. And I think it's work, it's necessary work, and I get that it's not statistically valid, but it's a good indicator of, I think, of what needs and preferences there are out there. But I'm just wondering if there might be a more systematic way to get at some of that through exit surveys, or maybe doing these surveys on some sort of regular schedule, so that the department can get regular feedback and maybe start to look at trend lines and so on over time to better adjust programs and services into the future. Thanks, Madam Chair.
Thank you, Emily O'Reilly. Ms. Czerkowski?
Thank you. We are absolutely looking at doing this on a more regular basis. So it is a survey that we intend to make part of our sort of ongoing engagement efforts. And I think that, apart from surveys, there are other ways that we, hear from residents and engage on an ongoing basis. We do have systems built into our health and social services system, like we have frequent engagement with the Leadership Council, with our regional wellness councils, with the Indigenous Advisory Body, which is sort of like the program level representatives of the Indigenous governments. So I think that we have other mechanisms where we also are hearing from people, on the services that we're providing and what their experiences are like with those, what their perceptions are of them. And we do also have data that we collect on an ongoing basis, whether it relates specifically to addictions treatment, but also to our ongoing programs and services. And we do routine analysis for trends of that data that comes in.
Thank you very much. Emily O'Reilly?
Yeah, no, thanks for that. Yeah, and I agree that there's other probably indicators of that you want to track, things like wait times, participation, completion rates, all of that kind of stuff. I guess where I'm going is I think that you need to probably have some kind of an evaluation framework for this service area, and I'm sure that's what you folks are working towards. So, but just one other thing. I did, while the presentation was going on, I had a chance to quickly call up the report. I really like the discussion section that you have in the report that's posted, because it actually indicates what you're actually looking at doing in response to the survey. And I think that's good. And if there's a way to kind of highlight that, maybe a little bit more bulleted, and so that people actually understand what you're doing with the data and what kind of change it's going to lead to. Now, of course, as MLAs, the next thing that we're going to look at or want to look at is the main estimates next year. And I know this is a political question, but I could just plant the seed with the staff that, you know, now that you have some results here, of course, we're going to be looking at how the funding that is available is targeted to meet the needs of the individuals that responded to the survey, and whether that envelope is big, should be bigger, and so on. So that's just, I guess, what I'm going to be looking for as an MLA in terms of the main estimates coming forward in the new year, to see how the department has responded in a financial sense, programmatic sense to the survey itself. So, look, I don't need a response on that, Madam Chair, but it's just a bit of a heads up as to what I'm looking for as an MLA moving forward with this. But look, I very much appreciate the work that they do, and this is an important piece of putting together the information to improve the lives of our residents. So thanks.
Thank you very much, MLA O'Reilly, and I won't put the staff member on the spot for answering a political question, but I'm sure she appreciates the heads up and also the support on this side of the House. Next on the list, I have MLA Whalen Armstrong.
Thank you. I do support the treatment, any cultural treatment program, whatever meets the needs of the people. So I think what I really support is that, because we're talking about NWT Recovery Experiences survey, that every region, it all depends, like there should be some form of a cultural-based treatment, just like my colleague said here. A facility, I know people are asking about that. A lot of people I've talked to, they said they need some form of a treatment program in their regions, because language and cultural practice is a barrier for a lot of them to leave their communities, their regions. And so I do, that's why there is some hesitance for people to leave the North. And then there's racism out there too as well. So people are scared of those things. And so what I want to mention too was that when I said we're in crisis, we are in crisis because, when the COVID first came, okay, because, like the Department of Health reacted to it because COVID, it can kill. And people were scared, so they did all the lockdown and everything. So it was the right thing to do. So they were trying to avoid people to get sick and, and die. But we still lost some people, and my heart goes out to the family. And what the government should have done, the GNWT should have done, was that reacted and spent the same amount of money that they did to COVID, to the addiction issues. Because the majority of the population here are Indigenous people, and here it says on the survey from age 16 to 19, we have a lot of issues with people with addiction, with drugs, especially drugs now, the street drugs. So they didn't respond. So what the government should have done was that as soon as young people, families start complaining or that we have addiction issues, they should have put the same emphasis on addiction as they did to COVID-19. Thank you.
Thank you very much, Emily Whalen Armstrong. Ms. Czerkowski?
I think what I hear is that, this is a territorial issue. This is an issue that impacts, all families and all communities, and that it needs to have the same level of priority placed on it as other issues facing the territory. So I don't disagree. I think that there is commitment to be dealing with the issue of addictions. I think we recognize we need to do a better job, and I think that we're taking steps to do that, and happy to hear suggestions on how we can do better.
Thank you very much, Ms. Czerkowski. Emily Whalen Armstrong, do you have a follow-up?
No, thank you. Just one more, because we all know that, we all know a lot of people that were impacted by drugs and alcohol does kill more people in NWT than any other disease. So that's why I said that, the government should have reacted quickly when we start having these problems. So thank you.
Thank you, Emily Whalen Armstrong. Members, are there any other members with some questions? Emily Simpson.
Thank you, Madam Chair. Listening to the conversation here, I think that probably if we look around the room and on the screens, there's probably not one of us not impacted somehow by addictions. I guess when I look at the information that was provided, one thing I don't see in there, and I'm not sure why, and maybe it is there somewhere, is I don't see why, like in the communities or in Yellowknife, does the lack of education impact addictions and the way it's treated? Does not having housing impact addictions and the way it's treated? Does being unemployed impact addictions and how it's treated? We have all those scenarios, and then even in not being able to, maybe not having the resources to travel and being in a community your whole life and maybe never going to Edmonton. Like there's all those things that I think that have to be taken into account as well to be able to provide a proper treatment program, because if somebody is they've been unemployed, they got a family, maybe they feel like that they haven't accomplished anything, and it maybe drives them to addiction. I don't know. And so those are the things that I'd like to see, so I get an idea myself of what's driving it in the communities and in Yellowknife. Thank you.
Thank you, Emily Simpson. Ms. Czerkowski?
Thank you. The survey did, you're right, it didn't focus so much on the root causes or what might be driving addictions. It really was focused on on understanding the services that people access and what they need to support them with it once that addiction is present. So I can hear and appreciate that comment. In terms of, though, sort of how we work with people and how we support them with their addictions recovery, I think all of those factors would be taken into account. We really are trying to take and move towards a person-centered approach. So where there isn't a one-size-fits-all, where we're working directly with the person, they are driving their care, they are the ones setting their goals and what they want to work on. And so I think that, if the goal was to go to treatment, then we would support them to get to treatment. If the goal was to work towards employment skills, then we would work with them to support them to do that. So I think, I don't know if that 100% answers the question, but I think that we recognize that the root causes are different for different people, and the factors that may make their recovery difficult are different for different people, and that taking a person-centered approach is the best way that we can support, all of those unique needs and goals that people have for their wellness.
Thank you, Ms. Czerkowski. Emily Simpson, do you have a follow-up question?
I appreciate that response, and and there's no doubt that that this has to be, we've got to deal with this head on, and as an Indigenous person, and I look at how things have transpired over the years. We went from where we go and we meet with people. You know, we've met with people face to face. You know, we see people on the street, we get to talk to them, and we're getting away from that. And maybe that's fine. Maybe it works for younger generation, but I know, at least for myself, as a MLA and in Hay River, is that I like to have an open door policy where I can meet with people face to face. It's, you know, I'm not sure if it's just because I'm older or because I think that it's more productive, and you know, the people can get a sense. I can get a sense of, you know, where they're coming from, and they can get a sense if I really care. You know, and I need them to know that I do care, and they can probably read that. The other thing as well is that, you know, I'm just thinking about Hay River again, is that we have people on the street, and I don't see a lot of social workers on the street. We have issues, and people should be, you know, you got to go to where your clients are, you know, and if you don't do that, you're not going to reach all of them. And you know, and I'm not saying anything bad about, you know, the social workers. More than likely, we don't have enough of them, but we do need some outreach workers who go around and talk to them. And I think that's so important, because it would solve a lot of problems. Because right now, in the small communities and even the regional centers, the outreach workers probably for that are the MLAs. Because I know, you know, I deal with people on the street every day, and you know, I help where I can, and provide them, you know, advice, and you know, where they can go and get service, and then, you know, always give them that option to come back to me if they don't get satisfaction, and we always look for another way around their issues. So I guess more of a comment and than anything. Thank you.
Thank you, MLA Simpson. Ms. Czerkowski, did you want the opportunity to respond?
All I can just say is thank you. And I would agree that, to be the most effective, we need to meet people where they're at. And that's not just about their goals and objectives. That's about physically where is the person, right? And that's part of access is making ourselves available in a way that works for folks. So I hear the members' comment, and I appreciate it. Thank you.
Thank you very much. Members, are there any additional questions at this time? Seeing none, I'd like to take this opportunity to thank the Department of Health and Social Services for providing this public presentation to both committee and the public who would like the opportunity to learn alongside us. So thank you very much for your time today. As you can see, this is a topic that is very important to committee. It has an impact on every single one of the constituencies that we serve, and we value the opportunity to provide feedback from our constituents. So thank you very much.
Thank you for the opportunity.
Thank you. So members, we will now move in camera. Thank you.